Antibiotic-associated diarrhea describes frequent, watery bowel movements, diarrhea, that occur in response to medications used to treat bacterial infections, antibiotics. Most often, antibiotic-associated diarrhea is mild and clears up shortly after you stop taking the antibiotic. But in some cases, antibiotic-associated diarrhea leads to colitis, an inflammation of your colon, or a more serious form of colitis called pseudomembranous colitis. Both can cause abdominal pain, fever, and bloody diarrhea. Mild antibiotic-associated diarrhea may not require treatment. More serious antibiotic-associated diarrhea may require stopping or switching antibiotic medications. Symptoms: antibiotic-associated diarrhea can cause signs and symptoms that range from mild to severe. Common signs and symptoms: for most people, antibiotic-associated diarrhea causes mild signs and symptoms, such as loose stools, more frequent bowel movements. Antibiotic-associated diarrhea is likely to begin about a week after you start the antibiotic therapy. Sometimes, however, diarrhea and other symptoms may not appear for days or even weeks after you've finished antibiotic treatment. More serious signs and symptoms: some people experience a more serious form of antibiotic-associated diarrhea when the overgrowth of harmful bacteria is severe. You may have signs and symptoms of colitis or pseudomembranous colitis, such as frequent watery diarrhea, abdominal pain and cramping, fever, mucus in your stool, bloody stools, nausea, loss of appetite. Causes: antibiotic-associated diarrhea occurs when antibacterial medications, antibiotics, upset the balance of good and bad bacteria in your gastrointestinal tract. The antibiotics most likely to cause diarrhea. Nearly all antibiotics can cause antibiotic-associated diarrhea. Colitis or pseudomembranous colitis. The antibiotics most commonly linked to antibiotic-associated diarrhea include cephalosporins such as cefixime, Suprax, and cefpodoxime, clindamycin, Cleocin, penicillins such as amoxicillin, Amaxil, Laratid others and ampicillin, fluoroquinolones such as ciprofloxacin, Cipro, and levofloxacin, Levaquin. How antibiotics cause diarrhea. Your digestive tract is a complex ecosystem that's home to millions of microorganisms, intestinal flora, including hundreds of species of bacteria. Many of these bacteria are beneficial, performing essential functions. But some of the bacteria that normally inhabit your intestinal tract are potentially dangerous. These harmful bacteria are usually kept in check by beneficial bacteria unless the delicate balance between the two is disturbed by illness, medications, or other factors. Antibiotics can be especially disruptive to intestinal flora because they destroy beneficial bacteria along with harmful ones, sometimes without enough good microorganisms. Bad bacteria that are resistant to the antibiotic you received grow out of control, producing toxins that can damage the bowel wall and trigger inflammation. Clostridium difficile causes most serious antibiotic-associated diarrhea. The bacterium responsible for almost all cases of pseudomembranous colitis and many instances of severe antibiotic-associated diarrhea is Clostridium difficile. Most people acquire a C. difficile infection during a stay in a hospital or nursing home after they've received antibiotics. Risk factors: antibiotic-associated diarrhea can occur in anyone who undergoes antibiotic therapy. But you're more likely to develop antibiotic-associated diarrhea if you have had antibiotic-associated diarrhea in the past, have taken antibiotic medications for an extended period of time, or are taking more than one antibiotic medication, are age 65 or older, have had surgery on your intestinal tract, have recently stayed in a hospital or nursing home, have a serious underlying illness affecting your intestines, such as inflammatory bowel disease, Crohn's disease or celiac disease. Complications: the most severe form of antibiotic-associated diarrhea. Pseudomembranous colitis can rarely lead to life-threatening complications, including dehydration. Severe diarrhea can lead to excessive loss of fluids and electrolytes, essential substances such as sodium and potassium. Extreme fluid loss can cause serious complications. Signs and symptoms of dehydration include a very dry mouth, intense thirst, little or no urination, and extreme weakness. A hole in your bowel, bowel perforation. Extensive damage to the lining of your large intestine can lead to a perforation in the wall of your intestine, requiring surgery to repair the hole. Toxic megacolon. In this condition, your colon becomes unable to expel gas and stool, causing it to become greatly distended, megacolon. Signs and symptoms of toxic megacolon include abdominal pain and swelling, fever and weakness. Toxic megacolon is a serious complication that can lead to infection or a ruptured colon. Toxic megacolon requires aggressive treatment, usually with medications or possibly surgery. Death. Severe complications caused by antibiotic-associated diarrhea can result in death. Tests and diagnosis. To diagnose antibiotic-associated diarrhea, your doctor may ask questions about your health history. Expect your doctor to ask about your medical history, including whether you've had recent hospitalizations or antibiotic treatments. Analyze a stool sample. If your symptoms are severe, you may be asked to provide samples of your stool. Stool samples can be tested in a laboratory to determine which bacteria are causing your antibiotic-associated diarrhea. This can help your doctor select the proper treatment. Treatments and drugs. Treatment for antibiotic-associated diarrhea depends on the severity of your signs and symptoms. Treatments to cope with mild antibiotic-associated diarrhea. If you have mild diarrhea, your symptoms may clear up within a few days after your antibiotic treatment ends. In some cases, your doctor may advise you to stop your antibiotic therapy until your diarrhea subsides. In the meantime, your doctor may recommend home care techniques to help you cope with diarrhea until it resolves on its own. Treatment to fight harmful bacteria in severe antibiotic-associated diarrhea. If you experience colitis or pseudomembranous colitis, your doctor may prescribe antibiotics to kill the harmful bacteria causing your antibiotic-associated diarrhea. For many people, this approach will clear up signs and symptoms. For those with pseudomembranous colitis, diarrhea symptoms may return and require repeated treatment. Lifestyle and home remedies. To help prevent antibiotic-associated diarrhea, try to take antibiotics only when necessary. Limit your antibiotic use and don't use antibiotics unless you and your doctor feel they're absolutely necessary. For instance, antibiotics can treat bacterial infections, but they won't help viral infections such as colds and flu. Ask caregivers to wash their hands. If you're hospitalized, ask each person you come in contact with to wash his or her hands before touching you. This may reduce the risk that you'll come in contact with C. difficile, the bacterium that can cause serious antibiotic-associated diarrhea. Tell your doctor if you've experienced antibiotic-associated diarrhea in the past. Having antibiotic-associated diarrhea once increases the chance that antibiotics may cause that same reaction again. Your doctor may select an antibiotic that is less likely to cause diarrhea. Consider probiotics if you've had antibiotic-associated diarrhea in the past. Probiotics are concentrated supplements of beneficial organisms, such as bacteria and yeast, that you take in capsule or liquid form. Some yogurts and other foods also contain probiotics.